Hey guys, so we're just getting done for the day here. I want to go over some of the wins that we had for our week. For those of you that don't know, we do nation and international health coaching, and we have our win board here for the week. So I know a few that are not on there, but I love this one. I don't know if you can see this okay. Lost 39 pounds in 78 days, which means this person lost half a pound a day for 78 days straight. So I don't know if you are wanting to lose weight or if you know someone that wants to lose weight. That's a pretty good way to do it. There's just some other people you can see, some other people with their weight loss wins for the week. So what we do is every week, the coaches, as we work with people, they go through and they write down their wins for the week, and they write down the biggest highlights that they've had. Another one that we got was there was someone that had heartburn, actually upwards of 75% improved. Another person lost 23 pounds in 2 months, which means they lost about 0.3 pounds a day for every day for 2 months straight. Another person, let's check out this one. So this person here had eczema. In their left arm. It was 100% resolved. In the right arm, 150% resolved. And this person had eczema for over 10 years. This person had eczema, and now it's completely gone in the left arm and 50% improved in the right arm. Another person over here, you can see the inflammation level, CRP, loving my body and myself again. I'm making healthier choices. Haven't had any delay down due to fatigue, decreased hip pain. This was one thing that I think was cool, was realize the state of the nation. I talked to a client today and said, Dr. Gala, I just have to say that ever since I've been going through your coaching materials and working with your team, I just traveled recently, and one of my friends who's a nurse said, I know the best diet for you to be doing, and for diabetes, worked with her, and her diabetes actually got worse. And she said, you know what, Dr. Gala, I realize now that the country is in such a state of disarray and poor health, and it was really eye-opening for me. It finally hit me when I looked around and I see all these people that are overweight, all these people that are on medications, and I see where their health is and that they're getting worse following mainstream advice. So if you or someone you know that wants to either get off metformin, reverse Parkinson's, get off of Zoloft to reduce insulin, get rid of some of the other medications, or they want to lose weight, they want to get rid of eczema, they want to get rid of their GERD, their acid reflux. What else do we get here? So one lady, her arthritis in her hands, 95% better. What else do we have here? One gentleman with his Parkinson's. In just 5 weeks, he'd been dealing with Parkinson's symptoms for about 7 years, and in 5 weeks, his wife says he's not hunched over anymore. He's picking up things, he's picking up his feet better, so he's not shuffling his feet anymore. He has better energy, better mental clarity, and he's more active and has better movement throughout the day. So if you or someone you know is either suffering with a chronic health issue, or they're on medications, or if you or someone you know is suffering, they have a lot of options. Feel free to reach out, post in the comments below if you like this video, or if you want someone to inspire, or someone that just needs a kind of a kick in the butt to let them know, hey, you can get healthy and your body can heal much more than you've been led to believe. There's options. I was talking to a medical doctor today from the Mayo Clinic, and he's a gastroenterologist for 30 years. And we were working with one of his mutual patients that we've been working with for 6 weeks. So 6 weeks we've been working with this mutual patient, Crohn's disease, since 1989, which means basically this person has not had a normal bowel movement, has had diarrhea essentially since 1989. And after 6 weeks of working with this person, the Crohn's disease is completely gone. And I have some of his information. So the gastroenterologist said that now this patient is in clinical complete remission and off all their Crohn's and autoimmune medications. And so this lady, even though she had several surgeries for her Crohn's disease, and she was on multiple medications, and this gastroenterologist from the Mayo Clinic was working with her and wasn't able to get her healthy. He was a great guy. He was a wonderful guy. Had nothing but positive things to say. Loved what we're doing. Loved to see his patients improve. But it just goes to illustrate that even some of the smartest docs out there don't have all the answers. So if you or someone else you know is suffering, the thing to realize is that this is what we do every single day. We get to see these wins, and we erase this board every single day, and we do a new one every week. And there's actually going to be more of stuff on this tomorrow. Look at brain fog better, sleeping better, digestion is the best it's been in years, more mental clarity, greater desire to do things, amazed that my back no longer hurts. When you start looking at all these things, these are our coaches that And these are just the things that our coaches think of putting on the boards. I always tell people, if you could follow me for one day or follow our coaching team or our doctors in one day, you would realize that your body can heal much more than you've been led to believe. And I would say, ask this. One of my buddies, my buddies from school, he did a post on Facebook, and it said, if your doctor wasn't able to write prescriptions or medications, what would they do for you? And that's a huge question. Ask yourself that. If my doctor didn't have a prescription pad, what would they do for me? And how would they accomplish that? How equipped would my doctor be if they didn't have the ability to write prescriptions? Because keep in mind, there's some research to suggest that upwards of 75% of office visits with a doctor ends in a prescription being written. And the average office visit is only about 12 to 14 minutes. Now, think about this. There's research that also shows that people over 60 are on 2 to 9 medications, and upwards of 62.5% of people over 60 are inappropriately medicated. So if you or someone you know is on medications, there's a very good chance that the mindset of, well, they're a really good doctor and everybody's doing it mindset is very well killing that person, or maybe making you sick or making them sick. So so please share this video with people. So right now, if you like this video, share it with people. Just get the information out that people can heal better than they've been led to believe. I'm trying to look at these other ones. I just love this one though. I mean, 39 pounds in 78 days. I mean, could you imagine losing a half a pound a day, every day, for 78 days straight? I mean, that's huge. This person, metformin, was down from 4 metformin to now just to 1. Cut back on Zoloft. I mean, you can see all these weight losses that these people have been winning on. I had a husband and wife team today as well. I was talking to their the husband. It was so funny. I'm talking to him. I say, "Oh, how's it going?" And the wife says, "Oh, well, I'm doing okay." I say, "What do you mean? You just told me you lost 11 pounds." She's like, "Yeah, but my husband's lost 13. So no matter how much weight people lose, it seems that they still they still want to lose more, or how much energy they want to have. Now, to be clear, a lot of people say, "Well, Dr. Gala, how do you get these results?" Well, this isn't just weight loss. We go after inflammation. In inflammation, there's about a dozen things that you have to go after for inflammation. A lot of people struggle losing weight. Why is it? Well, we know that losing weight isn't just about calories in, calories out. Losing weight is much more about reducing inflammation. Because think about it. When you are spraining your ankle, let's say you sprain your ankle and it swells up. Well, that's inflammation, right? People that have this subclinical or systemic full body inflammation, it's kind of like their full body is sprained and they're kind of puffy and swollen all the time. So when you get your inflammation down, two things happen. Number one, you start burning fat fast. Starts dripping off you. And then secondly, you get rid of the swelling, the inflammation, that kind of that puffiness. So you start losing weight from that direction as well. So obviously, weight improvement is just one, but you can see heartburn improved 75%, eczema best it's been in 10 years. In 10 years, eczema best it's been, and you can see a whole laundry list of highlights over here. And again, these are just the things that the coaches are recording. So if there's a topic that you want to learn about, post in the comments here, even just make a message right now. Put a message in there. What's a topic you'd like to hear about? Meaning, ask yourself this. If you could get rid of one thing health-wise right now, if you had a magic wand and you could get rid of one thing, what one thing would you like to get rid of? What would that be? Would it be less weight? Would it be getting off medications? Would it be more energy? Whatever that is, write that down, and then we'll see about maybe doing a video on it and messaging it later on some information. So again, I'm Dr. Gala. And hopefully this is helpful for inspiring you or inspiring others. If you found this helpful, share it with others right now. We've got to get the word out here because there's many people out there that are sick, that are on medications, and we're getting sicker as a nation, and we need to change the conversation. So again, I'm Dr. Gala, and here's to making the rest of your years the best of your years. We'll talk with you soon, and here's to making the rest the best.